Hi everybody, and welcome to my video on vibrational plates and how you can effectively use them to reverse osteopenia and osteoporosis when you are postmenopause or over 60 as a male. Hi, welcome to the Judy Terrell Show, where I explore topics intended to optimize every body 50, 60, 70, and above. Hi everybody, and welcome to my video on vibrational plates and how you can effectively use them to reverse osteopenia and osteoporosis when you are postmenopause or over 60 as a male. All right, everybody, I am Judy Terrell, and I'm a nationally board certified health coach. I am a personal trainer for 43 years with many, many clients through the years. I am a 14-time Ironman triathlete myself, and I am 62 years old, and I was diagnosed with osteopenia in my 30s because of very low estrogen due to my activity level, my athleticism, and body fat percentage. But now I will tell you that at 62, I have reversed low bone density, and by doing a variety of lifestyle practices, one of which I'm going to teach you in this video, and that is using the vibrational plates. All right, so hopefully you're going to be in a similar category by the end of this video, being able to be armed with a piece of information and what to get and how to use it that can help you if you are in osteopenia or osteoporosis, or honestly want to avoid getting that diagnosis. All right, so let's talk bone density. Why is it that women over 50 and men over 50 and 60 are more apt to have osteopenia and osteoporosis? Well, bone naturally degenerates over time and aids the replication of the bone cells, just like every other cell in our body, becomes less robust, more apt to have flaws in their DNA replications. And when we lower our estrogen levels once we go through menopause, estrogen helps to recruit the materials like calcium and vitamin D into the bones. And so we, as older women and older men, because even though they don't lose as much estrogen, they still are changing hormone structure as well, we are more prone to bone loss, okay? And the inability to generate new bone. Because bone is live tissue. It's constantly turning over. And that's where the osteoporosis medications are not really hitting the mark. 90% of the medications that are out for osteoporosis, they will slow down bone loss, but very few will generate bone regeneration and enhance that process. And so lifestyle things are able to do that, and the vibrational plate is one of them. All right, hold that thought for a second. So how do we, get bone to regenerate? Reload it, right? And so a lot of people now, they know that this information is out. You can Google Scholar and follow the science on this. But here's the issue. The newer released studies now on women over 50 postmenopause are finding that in order for you to actually do enough loading to get the makeup for the loss of estrogen, to actually get the bone formation loads high enough, you've got to be lifting 2 to 3 times your body weight in your lifts. So if you're a 150-pound woman, that means you have to be squatting with 300 pounds minimum. All right? Most of the women I work with, if we did that, even if we progress it appropriately, A, it's going to take us years to get up to that. B, they have joint issues like knees and back and hips, feet, that would be prohibitive for that loading. And so they're thinking they're doing the right thing by lifting heavy for them, but it's not heavy enough to actually reverse and create more bone because it's not enough load, all right? So hence, this is where the vibrational plates come in. And this is a game changer. The vibrational intensity of these plates is equivalent to that level of loading and higher, because most of the plates have a variety. They have a range. They go from the one that I'm going to give you a link for in the copy underneath this podcast is going to range from 1 to 120 levels, all right? And you want to start with the lower and build up, but when you get up to the 100 plus loading of this vibration, you are now in the range of stimulus, so that it's like above 2 times your body weight without doing the loading with the weights and without having to do the jump training. When you have tried all the programs and done all the right things, and yet you still can't lose the weight that you're trying to lose, and you're a male or female over 50, now is the time for you to look into my program, Your Second 50.life. It includes online video support. You can download video and PDFs for eating plan and exercise plan appropriate for over 50. It includes group support on a monthly basis, and perhaps even more importantly, it includes weekly individualized coaching specific to you. Having the generalized plan is a good thing. I have helped literally thousands of people to lose weight over the 43 years I've been in practice, and I'd like to help you too. Which is another way to get this kind of loading, because when you jump from a 15-inch platform or higher down to the floor, that's 3 to 5 times your body weight. But again, I myself, I have knee joint issues that I've had, again, since I'm very young. There's a bit of a genetic component there. So I can only do so much jump training, and that is why I use the vibrational plate and have it in my gym in the classes that I'm teaching and leading for women and men, but my classes are all women, to strengthen and to reverse osteopenia and osteoporosis. So the vibrational plates, when they first came out, I think it was like 25, 30 years ago, they were very expensive. They were very cumbersome, kind of like the first generation of computers, and they were like $15,000 and big, so nobody would have access to be using them at home. Now, the one I'm showing you in this video is $80 and is easily put under a couch and storable and then taken out on a day-to-day basis to use it. So there's very little limitations or barriers to their use, and they yield phenomenal results in terms of increased bone density, in terms of lymphatic drainage, because they're vibrating your entire body. So it helps with lymph fluid release and transport and conduction through your body. So there's a lot of secondary gains to these. They also help with balance training when you're standing on them. And you could be doing some balance work, standing on one leg versus another. Doing heel drops where you're standing up on your toes and then coming down on your heels while you're on the vibrational plate. So now you're getting secondary gain of increased lymphatic drainage and circulation and balance training while you are getting bone enhancement vibrational therapy as well. So I can't say enough about these plates. Now, there are a couple limitations. So if you are very, very hypertensive, unmedicated, this is probably not a good thing for you to use. If you have a pacemaker, the vibration is too intense and can throw off that, what that's doing to try and pace your heart. So would not be something that you want to use. If you've had recent joint surgery, within the last 6 months to a year, probably not the best choice for you. You want to wait until you're totally repaired from those surgeries. And then if you have retinal issues, you've had a retinal tear, or you're being monitored for, lower integrity of the tissue in the retina, and you're at risk of tears, this vibration is so high that could cause some issues. So if you're in any of those categories, but that is by far the minority of people. So most people will be able to use this device and get the benefits from it. All right, so all these plates have a lot of settings. I'm going to tell you right now, just like with treadmills and other things, simple is better. Put it on the manual setting. Don't worry about the interval settings or whatever things that are in there. Manual, and then bring the vibration up. If you're just starting, I would go to 50. If once you've been doing it for 4 weeks, you can start to increase to 100 and then up to the 120. I do start people off at the 100 and 120 mark, as long as they don't have vertigo issues and any of the, obviously that no one's getting on that has issues of what I just said, but some people have a little bit more vertigo. Then I'm going to try and titrate that up a little bit more progressively. But like what I've said, I found I can put people on it immediately at the 100 setting it goes up to 120. If you want to be conservative, start lower. Start at the 50. If that's okay for a week, then go to 75. If that's okay for a week, then go to the 100 and kind of progress it up. So that's how you're going to use the intensities. Then the duration. So you want to start off with 2 to 5 minutes, and you can just be standing on it, right? Just standing on it, and you feel the vibration. You want to stand up on it with one foot at a time and then bring the other foot up, because there is a balance piece. Same thing when you're getting off. Step off with one foot and then step off with the other and then stand there for a second. It's like getting off a boat at first. But those transitions aside, standing on top of it once you're there is pretty, comfortable. It's interesting. You feel everything vibrating, but that's why you're getting the bone regeneration that we're after. And you can either just stand on it. I tell people put it next to the chair that you sit in when you're watching TV. When a commercial comes on, stand on it. Stay on it for the 3 minutes, 5 minutes, and then get off and sit down, right? You can also stand on it and do bicep work or overhead shoulder work, standing tricep work, a variety of things. So you can kind of couple this into your weight training regime, put it in your gym setting, and then when you're doing some standing arm work, do the weights while you're on the vibrational plate. So it doesn't even take you any more time to do it. You don't have to sculpt that in any more time. You can also do balance work on it, standing and then stand on one leg, lifting one leg up, and then the opposite side, trying to go for 20 seconds, 30 seconds, and then extending that for maybe a minute, standing on one leg while you're on the vibrational plate. So you're getting this neurological, loading for balance to help prohibit falls when you're not on the vibrational plate. Again, secondary gain, while you're getting this increased vibration for the bones. So there's a variety of ways to use it, but you generally want to start with 2 minutes, build up to 5, every other day. So that's about 3 to 4 times a week. And then once you've got to 5, then you can get extra, benefit if you can increase it up to 15 minutes, every other day. Very easy to do, very easy to use. And aside from those limitations that I already highlighted, 90% of the population can use this. And here's the kicker and the most important part, everybody. It is getting you the vibrational stimulus that's equivalent to doing weight training at 2 times over your own body weight, which for many, many people is not even a reachable goal. And that is why you might read science. I know the Harvard newsletter on osteoporosis said you cannot reverse bone degeneration with lifestyle, and they're advocating that you have to take the medications. But I can tell you from my client base that is absolutely not true, because I have women and men who we have reversed their osteoporosis down into below osteopenia or into osteopenia by just doing the lifestyle, no medications. So I want you to, we're not trying to replace and scare you off, an integrative approach. There are people I work with who are coming into me that are already -4 or -3.5 osteoporosis. They make their own decision with their healthcare provider, but you want to be able to integrate, a both end approach. But what I'm trying to say is that there's a certain level of degeneration where, the person, the individual is scared and doesn't want to do things, because once you're past like -3.5, you can actually hurt your bones if you try to load them too much, because they're so weak and so porous. Like there's too much space in the bone and it can break, right? That is why sometimes they'll say, lifting is contraindicated even though you have osteoporosis, because it's too severe. And that's where the debate about the medications comes in. And everyone has to make their own individual decision. But I'm trying to help you catch this before you get to that level. And then I'm telling you that if you're at the -3.5 or less, -2.5, which is when most people will come to see me, because that's when you've just crossed over into osteoporosis, the lifestyle things, the loading, the vibrational plates, and making sure you're getting the substrates coming in, the vitamin D, calcium, vitamin K to help the absorption, a variety of intake things. You got to get the material in your body, and then you have to have the load together to get yourself out of the osteoporosis condition. All right. So the vibrational plates, huge advocate, use it myself, use it in my practice with clients who don't even have osteopenia or osteoporosis. Link below on one that you can order on Amazon. Questions, put them in the comments. I'm more than happy to address them. You're seeing these vibrational plates are, they're epidemic right now. They're making the wave on the social media. I wanted to give you a little bit more information about them and advocate to bring them into your program, even if you are you're saying I'm heavy lifting, because if the one thing I want you to take from this video is that your heavy lifting might not be heavy enough to reverse the bone, osteoporosis and osteopenia, and the vibrational plates are going to help you if you can't lift 2 or more times your body weight, especially in the lower body. All right, buddy. See you soon on another video. Please, if you find this information helpful, subscribe to my station, join my community, yoursecond50.life, where I'm putting out information about fitness and exercise, nutrition, sleep hygiene and help for sleep issues, stress management and the psychological, what are you saying to yourself inside your brain, a whole variety of lifestyle, realms, and you have to be working on all of them to have your most ideal health span. So check out that community, yoursecond50.life, and I will see you soon somewhere, I hope. Bye, everybody. And if you'd like to have access to some of my additional resources, I can be found at Facebook, Instagram, YouTube, and on my website, www.judyterrell.com.